Okay, so what this is going to be, I'm fixing to share with y'all, is basically troubleshooting your tinnitus, your ringing ears. So here's going to be the presentation. I'm kind of running off of it so you can follow along. But that being said, I've had issues with tinnitus. It hasn't been a long, long time. I'm like anybody else in life. I've had problems with my ears as we move through our life cycle. But this is going to be some of the things I've tried. Maybe they turned out right. Maybe they didn't do much for me at all. Most of them didn't work because apparently there's no set rule or no set spectrum of diagnostics that actually ends up with a 100% clear clinical result for the underlying factors that are making your tinnitus present itself. That being said, yes, you would think in the time that we live in that this would be an easy fix problem. I mean, yes, there's been some advances, but talk about slow. And the reason I'm putting this out is not just to give you an instructional of what I experienced and what's out there and the techniques that you have available, but also to get hopefully some feedback. So in this YouTube presentation, if you know something, please feedback to me so I can obviously have maybe another branch or another avenue to follow down. Um, if you don't, I would prefer that nobody send me irrelevant content. That doesn't mean no good. But if you know something that I don't, please, I would appreciate the help. But anyways, troubleshooting your tinnitus, ears ringing. What I've learned about ringing ears and hearing loss and things that may help you. Tinnitus can come from many issues. Hearing loss, jaw tension in your jaw, your TMJ, sinus issues or ENT issues, ears, nose, and throat issues, one or a combination of those issues. Pressure problems, um, loud noise exposure, stress, wax buildup, and more. So here are the things that may help you and what to I'll possibly look into. Now, the one thing that I have obviously dealt with has been, give me a second here, has obviously been just my ears ringing in general. So with the first one, we're just going to go step by step, look at them, and we'll have a little chat about them. Very brief. I don't want to hold you up. So jaw and tongue pressure techniques. This one I learned off of somebody else. It didn't help me. You take your teeth, you clench your teeth, and you press either toward your teeth or up toward the palate of your mouth, and that's supposed to help relieve the temporal mandibular. There's muscles here, and obviously they lay close to some of the nerve ways and different structures that actually could affect the ears, obviously cause that secondary tinnitus. Didn't work for me. Pulling on the ear to pop the ears. Now, generally pulling on the ears to perform a pressure equalization technique, you literally just pull it up on it. I just pull it up on it and I hear it pop. And my right ear does it, my left ear don't pop. So that being said, that's supposed to help equalize in pressures that may relieve tinnitus. If your tinnitus is related, more or less they're looking at like congestion, pressure, allergies, sinus issues, or past ENT problems. The next one is holding your breath, not till you pass out, but again, this is pressure equalization. So this technique actually just hold your breath, put your fingers on your nose, hold it. Don't press too hard with the air because it could actually rupture your eardrum. So that being said, be careful because it pushes pressure from the pharynx, your lower airway, and or you can say your upper airway, back up to your eustachian tubes and to your ears. So be careful about that. You just want to equalize the pressure or open up the eustachian tubes so that pressure can actually come back out and give you some kind of equalization. But if you press too hard, you could pop your eardrum. Now you're not just in a world of problems, you're probably in a world of pain. Earwax, had earwax built up in my ear. Your ENT can actually remove that. So have it checked by your ENT to see if it's there. It could be an underlying factor that possibly could cause it. Mine actually did have earwax in one ear, but the thing is, it didn't help with nothing. So keep that in mind because as you get older, your tubes in your ear actually go toward the forward portion and leaves an area in there that you don't always get clean when you're actually doing swabs. But ear swabs are only meant for the outer surface, just clean the outer canal, not meant to dig down into your eardrum. If not, you could damage your eardrum or cause yourself excruciating pain and possibly have to go to the hospital to obviously get some sort of treatment. And when you get a ruptured ear, there's not a lot that's going to make that eardrum or ear pain go away. So you're going to have a pretty rough ride and you did it to yourself. So get a hearing test. I got a hearing test. I'm missing high tone. That being said, it didn't give me a lot of information other than I'm missing that. But in that blind spot of that high tone could be where obviously the tinnitus is coming from. Now, my tinnitus does come and go, so I don't know what that means in that aspect. Um, but that being said, obviously you could compensate. It'll pull on down to number six with hearing aids. So if you got that blind spot, that spot that you're missing those different levels of pitches, then obviously you can compensate or white noise it out with the hearing aid. Hearing aids are really expensive. I haven't found one that particularly I've liked yet, that because I'm willing to try it. My mother was crying to me because my mother's older. She complains about hearing loss, but she says she don't want a big contraption hanging on her head. I wouldn't either in the reference to that because the simple point is obviously I've got to be able to function and do my day-to-day activities, and I don't want to have to keep fighting with that. I already fight with glasses, okay? So that's just adding to a problem. But that being said, I've seen some other alternative approaches to it, like one that goes through the mastoid bone, the vibrations that you can actually hear. It makes noise audible for people that actually have complete, like apparently complete hearing loss or something to that degree. I'm not too depth on the complete procedure, but I know that's available. And then the other thing is you got to look at is the cochlea. The cochlea actually has these hair fibers in it. They're sensory hairs that actually convert sound signal to the brain because noise actually is an electrical signal. But obviously, they can get damaged with age, loud noise, infections, and other causes. So keep that in mind. That could be your overall problem. Do I think it's my overall problem? I'm really not completely settled on any of them. That's the only one that I can't really make a great distinguish between. What's the distinguishation? I can't distinguish if that's it or not. Shit. But that being said, that may be the underlying problem. I don't know. But that being said, there's nobody that I've ran into ENT wise that really has any in-depth knowledge. And you'd be surprised they got doctor in front of their name. They can really give me any in-depth help when it comes to how do we troubleshoot this aspect of the hearing, the sensory of being able to hear and determine if that's it. So I'm out in the breeze on that one. But other things that can affect and give you tinnitus is obviously from the loud noises, stress and anxiety. Don't give it no credence. It actually does could cause these problems. Sleep problems. I do have a tendency when I sleep better, I do seem to have less problems with the noise. It's probably possibly still there, but sometimes I don't recognize it. So maybe I've learned to look past it to some degree. But like even now, my ears are ringing even now. They're at a lower pitch, and sometimes it's really high. And when it gets really high, it kind of worries me. But it could be even vascular problems. So don't think the vascular system can't have an issue with this. Also, high blood pressure, maintain your blood pressure no matter whether it has to do with tinnitus or not. Blood pressure is an extremely important one. You don't want a heart attack. You don't want a stroke. So keep that in mind. Sinus congestion, good possibility, but I don't deal with sinus problems all the time. And like we said, the TMJ and jaw clenching make those muscles relax, and it may actually help relieve that tinnitus. Certain medications, absolutely. Acetaminophen is definitely one of them. I do Tylenol, but I don't mess with NSAIDs because of the blood pressure. I don't like having that problem. I have seen it mess with my blood pressure for the NSAIDs. Also, ear infections, pretty good possibility. Of course, that's not my underlying problem. So when I say not a great option for me, it's not that it doesn't affect everybody because we're all built differently with the way we're structured. Everything's not always in the same spot as the next person. It's in the general area, but every one of us is actually designed differently. And then obviously overall hearing loss, that may be mine. That's the one I'm leaning toward the most. That's the reason I'm looking at hearing aids. But the reason I'm putting this out here is to give you some update, some insight on what I've dealt with and how these things help me. So if you're looking at these different perspectives, hopefully something I'm saying rings home with you and obviously pushes you more in the right direction toward what you need to look toward to hopefully get some kind of resolution. So final thoughts is tinnitus is different in everybody. What helps one person may or may not help another, but it's worth troubleshooting possible causes instead of just ignoring them. Sorry. But sometimes improving the underlying issue can reduce the ringing. If you've got ringing ears, go get an ear check. Go get your ears checked. And because where they do ear check and ENT, that's usually a diagnostic clinic versus going to the ENT talking to them. They can remove the earwax. Some of these techniques about jaw tension and stuff. If that's yours, then I'd probably like to know more about it. So in my YouTube, I'm leaving it open so people can send recommendations, also things that they're dealing with that maybe I can troubleshoot myself better. Let's see if I can figure out what's actually causing this problem. And obviously protect your hearing from loud noises. This is after the fact. I was young, dumb type of deal. Guns, explosions, noisy 18-wheelers, big boy toys, So that may have been what actually caused some of my problem. Whether it has to do with the tinnitus, I don't know. So don't ignore your hearing loss. It is extremely important, and now it's become an issue for me. And I obviously would like to hopefully get it where you being proactive so it doesn't become a long-term issue for you. Now, obviously remember your ears, your health, your quality of life. Take the time, it can help, and be proactive to protect your hearing. So this information is only educational purposes. It's not for medical advice. Always consult a healthcare professional for diagnosis and treatment. But remember, they read a book too. So make sure who's treating you really does know what they're doing. They've got some kind of insight. If they don't, steer away from them. Find the right practitioner that can actually help you hopefully find the underlying problem and find some sort of treatment toward hopefully resolving the problem altogether. I don't know why technology is still so far behind, but it's like it's growing at a snail's ass pace. And that for us out here that are dealing with different health issues, and I get it, no matter if it's your kidneys, your heart, whatever it might be. I know that me being in medicine, I definitely have learned to appreciate what I used to see versus what I know now. So I hope you all the best. But when it comes to your hearing, please reach out if you know something. Now, outside that, I always throw this in here. The company that I own is Truck Driver Nation. So if you actually want to work from home as an independent freight dispatcher, dispatching semi trucks in the United States from home, please go to our website, truckdrivernation.com. On the homepage, there's links that you can actually get a hold of me or the back office to give you assistance. If you need training or you just need a job, you've already got experience in there, please reach out to us. We'd love the opportunity to work with you or train you and help you get moving forward and generating income dispatching professional CDLA drivers. So that being said, I'll kind of leave it at that. But anyways, I appreciate it. I hope this helps you out. Like I said, like or subscribe if this did help you out. I don't know how that helps me, but I know to ask for that part. But that being said, please make sure to leave your comments because that's going to be left open because you have to put the settings on here. So I'm going to leave that open. So hopefully if you got something to say that's progressive, please do. And if you don't have nothing but hypotheticals, I don't mind having them, but sarcasm, all that other stuff. I know there's a lot of haters out here. We all deal with them. Please keep your comments to yourself. It doesn't help me and doesn't help anybody else looking to the comments in here to hopefully help them out. But that being said, appreciate your time. And I hope to obviously see you in my next webinar. Please, I mean, not webinar, but YouTube presentation. Please go to Truck Driver Nation. We've been doing more and more of these things. I just do things that affect me, things that have to do with my business. And obviously, if you're interested in living abroad, we do a lot of content in relation to that as well. But anyways, thank you so much. And I look forward to obviously talking with you again. And I appreciate it. Thank you.